This morning, according to the American Cancer Society, cancer deaths in the U.S. are falling. But experts are seeing a rise in diagnosis in one group, younger Americans. This morning, one doctor tells me there are a number of reasons. A routine mammogram nearly 4 years ago began as an ordinary one for Rhonda Miller. But 7 months later, a shift happened.
One day, my left breast just started hurting, just overnight.
After intensive chemotherapy, a double mastectomy, and radiation treatments for nearly 8 months, Miller finished last May. But the 54-year-old says the surgeries were not the most shocking thing to her.
When I was doing chemo, there were younger women in there, younger than me, maybe 23, 19. They're getting treated for cancer.
A trend health leaders are beginning to notice. A recent study from the American Cancer Society found Generation X and Millennials have a higher risk of developing certain cancers compared to older generations.
This information surprised a lot of us in the cancer world.
Colorectal, uterine, and breast cancer among the 17 listed. Dr. Wally Curran, an oncologist with Piedmont Hospital, tells me it's not clear what's behind this. There are, however, risk factors.
Childhood obesity, perhaps less physical activity, and a less healthy diet.
Dr. Curran suggests climate changes are also impacting people, something also mentioned in the study.
We have to think about how when it's 90 degrees, 20 days a row in Georgia, how do we get our children to still be active?
As of now, he says the best line of defense is visiting your primary care doctor. Meanwhile, Miller will continue to advocate.
I say it's cold and it's uncomfortable, but what's a little pain for 5 or 10 minutes? Then have a pain for months and maybe years.
Well, a good reminder, breast cancer screening should start around your 40s. Test for colon cancer late 40s or 50s. But if you have worrisome symptoms at an earlier age, of course, don't wait around. We'll post information on symptoms you should watch for on 13WMAZ.com.